Hey guys, thanks so much for having us. I'm Dr. Mehta. I think I met some of you guys last year. Quick show of hands. Who was here last year when we did, or I think it was in March of this year, when we did a workshop? Okay, so only some of you guys. So there's a whole bunch of new faces, which is awesome because you're going to learn a bunch of stuff. I think we had a really exciting day for you guys all. We all planned. You see, I'm trying to use you all because I'm in Texas, even though I'm from the Northeast here. I think it'll be, what our goal here today is to try to get you guys to understand a little bit about medicine, understand a little bit about international volunteering, starting nonprofits. We got the U.S. Army coming in to do a Stop the Bleed session. So if you guys are ever in the middle of a battlefield, you learn how to stop some bleeding. And then we have time for a few other things as well. I want to talk to you guys a little bit about the history of medicine, the future of medicine, AI, maybe a suture workshop. I got a lot of bananas, so unless people are really hungry, we can suture them up. So we'll have a bunch of fun today. I think it'll be an awesome day. Quick show of hands, freshmen. Okay, tons of freshmen. That's awesome. Sweet. Welcome to campus. How many weeks have you guys been here so far? 5 weeks. Okay, awesome. How many of you guys are from Texas? Okay, so nobody thinks it's too hot here. Okay. For me, it's way too hot right now, but all good. Well, welcome. I mean, you guys, as freshmen, this is just the perfect time to start learning, to start understanding what you're going to have to do to eventually make your either med school, law school, business school, whatever you decide to do, a reality. Another quick show of hands. How many of you guys are pre-med or pre-health in some way? Okay, cool. Found the right audience. That's good. So that's great. So I'm here for you guys to answer questions, talk through what it might take. Let's keep this interactive as we go through because it'll be more fun that way, okay? What I like to talk about is everything you need to know about being a pre-med and how it's changing too, right? So just as a little bit of background, I'm an interventional radiologist. I graduated medical school, 2 decades ago at this point. I've practiced for the last 10 years in Boston. I'm on faculty at Harvard. I work at a hospital called Beth Deaconess Medical Center. And I founded MedSchoolCoach, which is a company that helps students like yourself sort of go through the process of becoming doctors. We've worked with probably 10 to 20,000 students at this point, start to finish, helping them sort of on their pre-med journey and make sure that they get into and through medical school. So quickly, our agenda for today. I'm going to go over what you should know about being a pre-med, how you can stand out. We have Sergeant Christian Rodriguez coming in for Stop the Bleed. Dr. Sheila Vora, who's down here from Global Brigades. She's the founder of Global Brigades. It's such an inspiring story. I can't wait for you guys to meet her and hear the story about Global Brigades. How many of you guys are Global Brigades members? Do you guys know? Awesome. So we got a couple. By the end of this, you guys will all become Global Brigades members because it's such an awesome organization to be a part of and really make a huge impact for. And then I said the history of medicine. Maybe we'll do some mock interviews. We'll do some suture workshops. How many of you guys know how to suture? All right, a couple of you guys know how to suture. Awesome. We'll go through all this. It's going to be a fun day. All right, so I said I practice interventional radiology, and I like to start this talk with a little bit of what the heck is interventional radiology. Anybody know what it is? Yeah.
So do you more so like specialize with the MRIs and do like minor procedures and stuff like that?
So kind of, maybe sort of. But the real answer is interventional radiology is magic, okay? So it's like surgery, except it's magical. So what I do is I do endovascular procedures under image guidance, right? So I use MRI, CT scanners, fluoroscopy, X-ray dye, those kind of things, ultrasound, to essentially do procedures in the body. So things that used to require big open surgeries, I can now do very minimally invasively. Things where patients are too sick to get surgery, we can do through catheter-based interventions. So stents in the heart, retrieving blood clots from the brain, opening up the legs because there's a clot in the leg. All those kind of things are interventional radiology. And it's really an awesome field. So for those of you guys who haven't heard of it, this is maybe your first introduction to it, and it's really great. So I got a quick patient scenario here, right? So I got a 46-year-old gentleman who's coming in, and he presents coughing up blood. Does anybody know what coughing up blood? What is the medical term for that? Maybe any EMTs in the crowd? Yeah. Hematemesis, right? So that is coughing or vomiting up blood. Well, it's actually vomiting up blood. Do you know some of the other words that are associated with people spewing blood from their mouth? Hematemesis is one. Hemoptysis is another one. That's coughing up blood, right? So quick lesson, right? Hematemesis, vomiting blood. Hemoptysis, coughing up blood. Hematochezia, passing of blood from the anus. Hematoma, localized blood. Hematocrit, the ratio of RBCs to blood volume. Hemoglobin, it's a protein that transports oxygen. So why am I telling you all this? Because you guys should really learn Latin, and you should all be Latin majors if you want to go into medicine. Actually, that's not true. These are all Greek words, I found out. It turns out Latin is not what you need to know. But anyway, this is just a quick lesson for you, right? So actually, Latin, Greek, all these things are super helpful for anybody who's out there who's thinking about like an additional class to take to maybe help yourself. Some of these things are actually pretty helpful in medicine. So you guys are all taking biology, right? At least in high school. You guys remember that there's essentially two different blood systems for the human body, right? There's the arterial and venous system, right? Pumps blood from your heart, goes to your arteries, comes back through your veins, right? And then does anybody know the other blood system? What it's called? Where it comes from? You guys all forgot biology? The portal venous system. So it's the stuff that comes from your gut, right? So your gut has its own blood supply that goes through the liver, right? What's the liver do? Function of the liver. Yeah, broadly speaking. Anybody? Filters out blood. That's exactly right, right? The liver filters out blood, right? So you get blood, you eat stuff, right? Those nutrients are absorbed by the gut. The gut is going to take it through the venous system, the portal venous system, and put it through the liver, right? So in a normal person, the blood goes sort of up the inferior mesenteric vein, goes through the liver, gets filtered out, and then goes to the hepatic veins and to the heart, where it then gets pumped to the remainder of the system, right? Brain, legs, arms, everything else. Now, why do I tell you this? Because I had a gentleman, who I just told you, who came in coughing up blood, right? One of the biggest things that people have when they cough up blood is something called cirrhosis. What's cirrhosis?
Hardening of the liver.
Hardening of the liver. That's right. How do you get it? Anybody? How do you get cirrhosis?
Too much alcohol.
Alcohol is a huge, huge component of it, right? Other things that cause cirrhosis? Yeah. Smoking does not actually really cause cirrhosis per se, but smoking's bad for you in all kinds of other ways, so we'll give you credit, right? What else? Hepatitis can cause cirrhosis, right? Viral injuries. What else? It's one other big thing, yeah. Poor diet. So there's something called fatty liver disease, right? It's not always associated with poor diet, but it certainly is good to think about poor diet as something. So it's called non-alcoholic steatosis or fatty liver disease, right? You eat too much crap, your liver ends up becoming full of crap, right? So it gets hardened, right? The cirrhosis is hardening of the liver. So why am I telling you this? So if your liver is too hard, what happens to that blood? Well, that blood that's supposed to go from your gut and be filtered out by the liver, right? There's a little red blood cell. It actually gets rejected and shot back the other way. And it goes up through these pathways that were open when you were an infant or neonate, or actually in the womb, I should say. So there's all these different passageways that were open when you were in the womb. It's a whole different blood supply, right? Because you have the placenta, you have the mother's blood supply, and then you have the baby's blood supply. But the baby has to breathe essentially from the mother. So there's all these different pathways that are open that close down at birth, but they're still there and they can open back up. And one of these big things that opens back up is called a varix, an esophageal or coronary varix. And these are the things that can bleed. So when you have somebody coughing up blood, one of the first things you think about is, oh, does this patient have cirrhosis? And is this an issue? Is this what's going on? So what can we do, right? So that's a picture from inside a scope, right? So that's a scope that goes in and actually looks at the blood, looks at the stomach. And you can see those you see how it's like kind of dilated and ugly in there? That should be nice and smooth. But what's happening is that those blood vessels on the other side are essentially growing in, and that's what ends up bleeding, right? And so this patient's coming in, they're vomiting tons of blood, so what can we do, right? So the medicine and the emergency medicine team downstairs, patients coming to the ER, right? I think we had one of our AMCAS national people. Where'd he go? I think he's gone. There was somebody from AMCAS national who's going into emergency medicine. He might take this patient and he would be able to stabilize that patient, right? He might give them blood products. He might give them fluids because they're vomiting and losing blood. They might start drugs for pressure support, right? Some things that helps constrict the arteries to keep them moving and keep blood moving, because the real loss is if you don't have blood flow, your brain shuts down, right? You need the blood flow to your brain. So they might do that. The GI team might come in and they might be able to band or essentially place a big balloon in the stomach to stop the bleeding, right? So how do you stop the bleed? Well, we're going to learn how to stop the bleed outside, but how do you stop the bleed from the inside? The biggest thing you do is hold pressure, right? You guys know that. Anytime you have a little nick, what do? You hold a little pressure, right? That'll stop the bleeding. Well, you can do that actually from the inside of the body. You can essentially inflate a giant balloon and stop the bleeding that way. So you're but you can't live with a balloon, right? That's not going to work for a long time. Or the patient might need a transplant, right? That's the ultimate solution to this problem because they have a crappy liver. But you can't do that in the emergency setting, right? The patient's bleeding, you can't rush them to transplant, you can't go find a liver somewhere out of nowhere. So what do? They call interventional radiology, right? They call me. And what I can do is I can actually save this person's life by creating a totally new pathway of blood. And I'll do this by just going with one little nick through the neck. And I'll put a really long needle in. I'll connect two systems. So I'll connect the portal venous system and the heart together. And then at the end, I'll put a little Band-Aid on. Do you guys know who this is? Chuck Norris, all right? When Sheetal and I were in college years ago, Chuck Norris facts were really, really cool. I don't think they are anymore, but this was like an internet phenomenon back in 2005. Chuck Norris internet facts, look it up. But when I learned about this in med school, I automatically thought of Chuck Norris because I was like, that is wild. How did you just do that? How do we just create a whole new pathway for blood to flow through and essentially save this person's life? And I remember learning about it in med school and just being like, that's crazy. That's one of the coolest things ever. I want to do that specialty. And that's why I went into interventional radiology. And this is what I do sort of every day. Here's a quick video. Just, let's see if the video's playing. There we go. So what I'll do is I'll go in through the heart, right? You see that long catheter, get to where the liver is, then essentially stick my way with a very long needle. Here comes the needle into the portal vein, which is on the other side there. This is taking a pressure gradient, and then you'll see the needle coming in. And then I'll actually stick my way all the way to the other side and try to connect these dots to the portal vein. Because remember, the liver is so hard, right, that blood can't pass through, and that's what's causing all these issues. And so I'm going to put in essentially a stent into the liver right through this pathway that I created. So now blood can flow back that way and not through those. You see those ugly looking veins across the stomach, the ones on the right side of the screen there? Those are the varices that we want to, what's called decompress, right? We want the blood to start flowing back the other way. And here comes the stent. Stent goes in. And all of a sudden you have a new pathway for blood to flow through instead of through this, through the varices. And that can save that person's life. And we will save that person's life, right? Here comes the stent. This is nice and slow. There it is. That's exactly what the stent looks like. And then you have this completely new pathway for blood to flow through, right? And so I thought this was really wild. Again, in med school, this is sort of the tool set that we use, which is what's called a needle, a stent. It's a Viator stent that goes in. And this is what it looks like when I'm actually doing it. So this is all I'm seeing, right? All I'm seeing is live x-rays while I'm doing all this. This big thing here that all is not supposed to be there. This is all blood going to places where it's not supposed to go. But once you put this stent in and knock off that blood supply by what's called embolizing it, now all of a sudden that blood is no longer flowing to those varices and this patient is no longer bleeding. Now, why do I give you this whole story, right? I give you this whole story because at the end of the day, medicine is super, super cool, right? All of you guys are embarking upon a career that I think is really awesome at the end of the day. This is something that's a lot of fun. Now, you guys are sitting here on a Saturday. You're going to be spending a lot of time at the library on Saturdays and Sundays, on Friday nights, and every other night of the week, right? You're going to not be making a lot of money for a lot of years. But at the end of the day, the stuff that you get to do, I think is really unique, and I think is really cool. And I don't think there's a single career that sort of impacts humans as much as health in general, right? So if you're in the healthcare pathway, you're sort of doing something that is really transcending, right? Hippocrates, life is short, art is long. You guys know probably that the pathway is going to be a really long way out from here, right? And one of the things I like to tell my students really early is that everything I just told you about that TIPS procedure and everything else, probably in 20 years, somebody's going to come back and be like, what? Why the hell did you do that? We have a magic pill for that now, right? That's what we think back when we look about 50 years ago, maybe when people are doing whole body radiation or something crazy. We think that was crazy. Why would you do something like that? The reality is we don't know anything. We're at the cusp. You guys are going to be part of a generation of physicians that are going to be able to do so many more things than we are today and so many more things than we were 20 years ago. It's going to be really cool. We're really at the cusp of this. And that's what my second talk is going to be a little bit more about. Did you have a question? Okay. If you do have questions, ask away. Does anybody have a question? Yeah. Good question. We're going to save that for a second one. What else? Any other questions so far? Yeah.
So you learned how to do that procedure in residency?
Yeah. So let's talk about the pathway, right? So for those of you guys that don't know, here's the pathway. It's a good question for a segue of what you're going to have to do, right? So you guys are all freshmen in college, bright-eyed and bushy-tailed, ready to go, right? You got 4 years of college. You got 1 or 2 years of maybe gap years, post-bac, special master's program, research, volunteerism, scribing, all kinds of other things that you might be doing. Then you're finally going to get to med school, right? Where you're going to have 4 years in med school. Then you're going to have a year of internship, 1 to 6 years of residency, 1 to 3 years of fellowship, and then finally you're going to become an attending. So let's count them up. 6 plus 3, 9, plus 1, 10, plus 8. You guys are probably like 15 to 18 years away before you're actually going to become medicine attendings, right? That's a long way away. And so along this entire pathway, you're going to learn and forget stuff. You're going to wonder sometimes why you're going into it. You're going to hit road bumps along this way. But I started with that story because at the end of the day, it's worth it and it's cool. It's fun what we do. Here are you guys, right? You started as pre-med college. For every 10 kids, you all raised your hand as pre-med. For every 10 kids who says they're pre-med, probably only 6 or so go on to take the actual MCAT. And then out of that, probably only 4 of those even get to the application. And then out of that, probably 2 people get in. Kind of sucks, right? I mean, you just raised your hands on, hey, we're all pre-meds. Well, how many of you guys are really going to get into med school? Probably not a whole lot. And that's kind of the reality of the weed out, right? And it happens, right? How many of you guys have taken orgo yet? Okay. Well, that's a weed out class, right? For those of you guys who haven't taken it, it's coming up. It's gonna be an issue. Then you got to take the MCAT, right? And here are the stats for now, right? So in just the last couple of years, there's been a huge increase in the number of applicants, about 20% more applicants, 17 to 18% more applicants in 2020 compared to 2019. That's a huge number. Now, after that, it leveled off again and sort of started growing again at the 1 to 2% pace. But that is a large number of applicants, and the number of seats in medical school haven't really gone up. Dell Medical School is one of the newer medical schools, right? only around for the last couple of years. But the reality is we don't have as many medical seats and we don't have as many medical enrollments as we do applicants. So it's just becoming more and more competitive. But the interesting thing is the average GPA and MCAT are actually about the same as they were years ago. So what does that tell you? That tells me that medical schools, while GPA and MCAT is super, 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 super important, don't get me wrong, we're looking for other things in applicants, right? We're looking for applicants who stand out from the crowd in some other way. And that's a little bit of what I want to talk to you about next, which is how are you going to stand out, right? How are you actually going to make your application something that is unique, something that somebody's going to look at and say, yeah, I want to take this student, I don't want to take this other student, I want to take this guy, right? He's got a unique application. She has a unique application because she's done interesting things. Maybe they've gone abroad. Maybe they've started a nonprofit. Maybe they've done a bunch of research, right? Maybe they've worked at the local volunteer clinic. All kinds of things that you could do, but these are all things that you're going to have to think about. I also want to pause for a second, just remind you that medicine is a really diverse field, right? Just to say, hey, I want to be a physician is not really good enough. Does anybody know what kind of doctor they want to be? Yeah. What kind of doctor do you want to be? Dermatologist. Very cool. How about you? Radiologist. Okay, cool. Well, we'll talk. Yourself?
I was actually thinking about interventional radiology.
Oh my God, I love this guy. This is awesome. Sweet. What else? Psychiatrist. Okay. Neurologist. All right. Anybody else? Yeah. Pathology. What about you? Pediatric psychiatrist. Yeah. Okay. Very cool. You guys can hang out with kids? Family medicine. Awesome. Yeah. Gynecology. All right. We just named like 15 specialties. I think everybody was something different and wanted to be something different. Do you have any idea how different the life of a pathologist is than a family medicine doc? Or the life of a pediatrician than a radiologist? It is so vastly different. And there are different personalities and different people that are going to go into it. There's differences in the day-to-day. And so as you go through this process, right, and you don't need to know what you want to be right now, but you're going to have to figure out, hey, if I want to be what'd you say again? Family medicine doc, that's a very different skill set and a very different lifestyle than the dermatologist or the gynecologist, right? It's totally different what you're going to do on an everyday basis, and your personality is going to be different. And so I sort of put the slide up just to remind you that there's all kinds of people who go into medicine, right? It doesn't have to be the most outgoing person. It doesn't have to be the person with the best bedside manner. It doesn't have to be the smartest person. It doesn't have to be a person with the best hands. Each of these things is going to be different depending on the specialty you might go into at the end of the day. So as you're going through this process, you may have some good ideas right now, which is awesome, but those ideas may change, right? Those ideas may really change, but I want you to be exposed to them. Shadow as many physicians as you can, get in front of as many people as you can, because you'll learn the different things that you want to be. Has anybody seen this slide before? Okay, this is sort of a humbling realization, right? It's called the UPS driver versus physician. It sort of circulated the internet maybe 5-10 years ago. And what it shows is that, hey, the red line is you as a physician. The brown line is a delivery driver, and the green line is a delivery driver working physician-like hours and working 60 hours a week on weekends. You guys know what a golden weekend is? Let me know what a golden weekend is? Yeah. Saturdays and Sundays off. A golden weekend. That is a medicine term. Why? Because the rest of the world just calls it a weekend. But in medicine, you call it a golden weekend if you get both days off, right? So you're going to have to realize that as you go through residency and fellowship and everything else, there are very few golden weekends, which means there are very few weekends, right? There's a great skit, maybe I'll pull it up, of a sort of doctor friend being like, I have a golden weekend. And the other guy's like, you mean just a weekend? It's like, yeah, I got a weekend. I'm only working till like 12 on Friday night. The reality is you're going to work very long hours, right? And you're not going to make a lot of money. In fact, you're going to lose money for a number of years, right? You got to pay for college. You got to pay for med school. It is a indebted process. You're going to be paying a lot of money to go through this, right? You got to pay for MCAT prep. You got to do a lot of stuff, and then you make a little bit of money as a resident, right? It's decent living wage, but it's not a lot. And then finally, you get to sort of start catching up. But look at where those lines intersect, right? So years after high school, think of the person who in high school who probably didn't make it to college or didn't want to go to college, wanted to go to trade school or something along those lines. You might have looked at them in college or in high school and said, wow, I'm a lot smarter than this person, right? I do a lot better in math and biology and everything else. But they're the ones who are going to be making a whole lot more money than you up until 20 years from now, when you might finally catch up to them, right? So I put this slide up just to say, hey, make sure you realize don't do this for the money, because it's going to take you a long time to get anywhere relevant. Most of you graduate with medical school debt. Most of you graduate with student debt. We got to pay this back. Depending on the specialty, it takes a while, right? But I go back to, again, why you go into this? Because it's a lot of fun, right? So what's it going to take for you guys to get in? Well, for a second, just relax, right? I'm going to go back to saying, hey, a lot of this is great at the end of the day. You get to really take care of patients. That is an awesome, awesome privilege that no other field has, right? If you're in healthcare, you get to take care of patients on an everyday level. That is an amazing, amazing thing. You guys are here at UT Austin. Congrats. One of the best schools in the country. Also, one of the schools with the most pre-meds in the country, right? Other than UCLA, you guys top the list here of most pre-meds from an institution. So there's about 1,000 of you every year that apply to the AMCAS application. And what's it going to take? Well, we talked a little bit about GPA and MCAT, right? I want you to focus. So this chart is actual data. It breaks down students by their GPA and across the board by their MCAT on top, and gives you their acceptance percentage, right? So let's take a 90th percentile MCAT score, which is something like a 514, and let's take a really respectable good GPA, let's say a 3.7, right? That's that. We'll take that. Only about 60% of those students will get in, and that's with a 90th percentile MCAT and a 3.7 GPA, right? And so now think, okay, if my GPA is not as good, if my MCAT's not as good, well, all these numbers start to get lower and lower and lower, right? And so GPA and MCAT are obviously really, really important, but they're not everything. Look all the way at the top. The people with great GPAs and great MCATs, even only 80% of those kids get into school, get into medical school. Those are the people who lack experiences, lack good ways to put their application together. These are things we're gonna hopefully hit on. Right, about 55,000 total applicants, around 22,000 matriculants. It's about 40%. All told, that's where we're at. And things are changing, right? And so this is a couple of things that are relatively new. You guys probably, some of you, as you guys were going through the high school process last year, right? How many of you guys had SAT optional? Is UT Austin SAT, ACT optional? Yeah, right? That's a whole new thing. That wasn't a thing when I was applying to college. That wasn't even a thing 5 years ago. Now all of a sudden you have optionality, right? US News and World Rankings, right? That thing has been like a maligned, horrible cause of stress for so many parents and students for years and years and years. And now that's going away. These are all probably good things for the application process, because honestly, at the end of the day, if you get into medical school, you should be ecstatic no matter where you are, period, end of story. Ecstatic wherever you get in. It is an awesome, awesome privilege. And then there's a whole bunch of stuff going on in the diversity, equity, and inclusion world, right? This is a graph of the percentage of family physicians who are from different races and the percentage of our population that are from different races, right? And you can see Hispanic, Latino, Black, we have a whole lot less doctors than we do patients, right? And that leads to worse patient outcomes at the end of the day. But you guys probably follow this or saw this, right? Just a couple of weeks ago, Supreme Court's SCOTUS decision, right? Affirmative action no longer a bill, or no longer a thing, right? Colleges can't use it. So now how do you train a diverse group of physicians if affirmative action is not allowed? These are questions that every medical school is asking, right? How am I going to evaluate an applicant? When you guys are going to put together your essays, those of you guys from underrepresented minority backgrounds, that might be your only chance to talk about your upbringing, right? But there might be other people from other backgrounds that need to talk about their upbringing. So these are all interesting things that are going on and going to change the landscape of admission in the next couple of years here substantially as you guys are going through it. But one thing that I can say for certain is not going to change is the expectation, by medical schools that we need people with not just good grades and MCAT scores, but great extracurricular activities, right? You guys had your club fair day or introduction to club fair day. How many, can somebody shout out an extracurricular activity that they're involved in that they think is unique or interesting? You got one? Yeah. Water polo. Very cool. What else? That's awesome. What else? Yeah. The Daily Texan. Okay. Is that a comedy or? A newspaper. Okay, not comedy. Not like The Onion. Okay, fair enough. What else? Yeah. Model UN, cool. So all of these things that you guys are talking about, right? The reason I asked you what unique ones is because when you go sit down at an interview for medical school, you know what I don't want to hear about? I don't really want to hear about the time you pushed around a patient in the hospital. That's boring. Everybody's done that. Now you got to do it. But I don't really want to talk to you about that. I do want to talk to you about water polo because I never played water polo. I want to talk to you about Taekwondo. That's cool, right? So as you guys are thinking about your extracurriculars, also think about like, hey, I'm not just checking off boxes for medical school. You have to do some things for medical school, agreed. But do some interesting things too. Do the things that you're really interested in, things that you didn't think you were going to do, right? Because that's actually what you're going to talk about on interviews. It's going to be what sets you apart comparatively. It's going to be what makes it interesting for me to sit down and interview you. Otherwise, I'm going to be bored, right? But there are other things that you could do as well, or things that you should do, right? You should think about longitudinal experiences. You should think about getting leadership roles. Come up with original ideas, maybe do international work. All these things are really, really, really impactful, right? And you have to do this in a way that hopefully you can sort of mesh together in a tangible application that really puts yourself in a different situation, right? Now, you guys probably know some of the pillars that you have to do, right? Everybody knows you got the shadow, you got to get some research experience, you have to have volunteer experience, clinical experience, leadership experience. These are all things that you have to do. And you might think, man, how am I going to do all these things? Or man, how does anybody set themselves apart? Well, I mean, I remind you for a second, right? Dr. Vora here started a nonprofit in undergrad that has helped, what, hundreds of thousands of patients in Central America at this point. Like, people do really incredible things. And just because you're an undergrad doesn't mean you can't do it, right? I'll let her tell the story. But you can really do amazing things as a college freshman. Don't limit yourself. You can really think outside the box. But to have those check boxes, here are some things that you're gonna have to do, right? So I say at least 100 hours of volunteering in the last 4 years, right? So get involved in trips, right? Get involved in your local chapters. Volunteer at the soup kitchen. All these things are important. You have to show altruism as you go through the application process. And then you want some shadowing, right? So I often say 3 different physicians and 3 specialties. You talked about all the different specialties that people wanted to go into here, which was awesome. Make sure you explore other ones, right? I went back to, hey, everybody's different in medicine. It's really important for you guys to show on your application that you've experienced maybe an ICU setting, maybe a surgical setting, maybe an outpatient setting. These are all important things for a medical school admissions committee to look at. For those of you guys who don't know what specialty you want to go to, and it's hard sometimes to get all the shadowing, go online. We actually have this whole shadowing series where we actually sit down with physicians of different specialties, and they'll go through different cases, and you might get interested. So I would encourage you to do this and actually say, you know what, family medicine is really cool. I want to do that. Or, wow, cardiology was awesome. That's something I want to go find a live physician to go do. Yeah.
On the previous slide, it said it was less important to get
Good. So shadowing is the cusp of what you need to do, right? So shadowing is, hey, I'm going to start and I'm going to be a fly on the wall. I'm observing this physician do something. But getting your own clinical experience or being your clinician yourself takes it to another level and now is needed, right? So what does that mean? That means you're involved in the patient care somehow. You're taking the vitals. You're taking the history and physical exam. You're an EMT. You're a scribe, right? So you're actively involved versus just being that fly on the wall. So as you go through this, you're going to have some specialties or some experiences where you are the fly on the wall, right? You're just going to be there observing, seeing what happens. But you have to take your application to another level by sometimes actually participating in the care of those patients somehow. And so that's what your own clinical work means. Yeah.
When should we have a preferred specialty in mind? Because I've spoken to many physicians about this. What they often told me is it's better to not hold off on this necessarily, but by the time we get to that specialty, will have changed so much, right? That it won't necessarily be unrecognizable, but to some extent. So when exactly is the opportunity to really know what specialty you want to go into?
Yeah, not until medical school and beyond. So not until you're actually applying to residency do you actually need to know what specialty. All these things that you're doing now lay the foundation and groundwork, because in medical school, the reality is you only have like 2 years in clinical rotations, right? And so you have a limited amount of time and you have to do surgery, medicine, anesthesia. Like you're gonna have to do a bunch of specialties across the board as your general requirements. But a lot of the specialties, a lot of like the extra specialties like ophthalmology, radiology, pathology, you're not gonna get exposure to necessarily off the bat. So if you have an idea from now that, hey, I'm interested in this, then during medical school, you could use those electives to choose those things. But you don't really have to make that decision until medical school. And you shouldn't make that decision to medical school because the reality is you don't know crap right now, right? Even if you're watching a physician in the office, you're not really understanding what they're doing necessarily. It's gonna take you a while. But just getting this exposure and understanding a little bit of like, hey, am I a hands person? Do I wanna do something surgical? Or am I a people person? Do I want to do something more psychiatry, medicine? Am I a kids person or am I an adult person? Like some of these like pathways can be helpful to understand now, but you don't have to pin down a specialty. So back to clinical work, right? So it's shadowing was a prereq, but clinical work is really what you end up needing. And this is direct patient interaction, right? So at least 50 to 100 hours. Again, like scribing is good. EMT work is good. Taking vitals is good, right? All these things, working in a clinic is good. These are things that actually you could say, hey, I've physically worked with a patient. I've interacted with a patient, and that's really important. And then research, right? So research is not necessarily needed at every medical school. There are some medical schools that are less emphasis on research, but almost every single school will want you to at least have explored this. And if you have explored it and you've gotten publications, it's really, really impactful. So I would recommend that you do actually start exploring some research, because the reality is if you can show a medical school, hey, I've done hypothesis-driven work, I've thought critically about the scientific process, that's really, really, really important. So get involved in a lab, get involved in academic studies, get involved in clinical studies. These are all important things to do. And then leadership, right? So every school is gonna want you to wanna have somebody who's a leader. As you go through your different extracurriculars, whether it be taekwondo or water polo or anything else, become the secretary, become the president, become the vice president, right? Work your way up. It doesn't have to be medicine necessarily, but it's really nice to have these leadership experiences, because it's going to, physicians at the end of the day are the leaders in the hospital setting, right? They're the head of the ship. They might be running the code, right? Patients coding on the table, they have to be running the code. They're ultimately responsible for the outcomes that happen. And so that's why all medical schools are looking for some of this, right? Now, a lot of you are probably going through here and being like, wow, that is a lot of stuff that I have to get on. And understood, it definitely is a lot of things that you have to do. One of the things that we've done in partnership with Global Brigades is actually come up with an opportunity internationally to get a lot of this experience in one fell swoop. It's not perfect in the sense that I want your experience to be longitudinal, But if you can participate in an experience like this in Panama, and Sheetal will talk a little bit more about the Panama rural medicine programs that Global Brigades has, it is a really cool way to essentially take 10 days, go travel internationally, get a whole bunch of experience clinically as well as research. And there's a component of sort of global med education because Global Brigades has clinics across the world. There's going to be a virtual component where you're actually going to be shadowing in different clinics across the world. So you can imagine how putting all this together in an application is going to eventually look really, really good if you can do it. And so we have experiences in January of this year, March, and June for 10 days. It's running in conjunction with Global Medical Brigades. You're going to go abroad. You're going to actually get research experience. You're going to get patient care experience. You're going to be in the rural clinics taking care of patients there. It is a really cool way to sort of check a lot of these boxes off in a break-like setting. So if you're interested, I'm happy to talk to you about it, or you can check out that website. And then MCAT, right? So MCAT is obviously something that is going to be important. MCAT is not going to go test optional in the next 3 or 4 years like the SAT did. It's just not. It may after that, but for now, you guys are all going to have to take the MCAT, and you're going to all have to do well on the MCAT, right? 4 sections: Chem Bio, CARS, which is used to be called verbal reasoning, biological, and psych soc is sort of the 4 sections of the MCAT, graded from a 472 to a 528. Why those numbers? I have no idea, but that's what it is. 500 is the top of the curve. Basically, you want to be well on this side of the curve, right? Only 40% of people get in, so if you get the 50th percentile score, you're sort of going to be left out. This is how it's eventually scored. This is the snapshot. This is like your future. You're eventually going to open this up in an email one day and either cry or have joy or any of these different emotions that you might have. I want you guys to all have joy when that time comes. And so as you're dealing with the MCAT, there's a couple of things you want to think about, right? Your best preparation is your pre-med classes. I could tell looks like I'm in a chemistry classroom. Is this where chemistry is taught? Biochem, chemistry, something, right? Like that periodic table, that I'm looking at that and I'm actually thinking, I have no idea what that means anymore. Which is incredible because the amount of time I spent studying the periodic table was, God knows, it was probably like 2 years. And I literally could not tell you a single thing about that anymore. But you guys could, and it's going to be important. So as you go through the best preparation is really your pre-med classes. Think about studying early in a passive mode, right? So audio courses like MCAT Go, super helpful. And then you need at least 6 weeks off. 6 weeks of studying if you're completely off, which is not possible for everybody. A lot of people are going to have work. A lot of people are going to have classes. So usually I say you want to spend at least 3 months sort of studying for the MCAT. AMC is the official sort of partner. That's the question bank you're going to take. You guys are all freshmen, so you're a little bit away from this. My recommendation would be, one, how many of you guys listen to podcasts? All right, what's your favorite podcast? What is it? What's that?
There's like a podcast from like this doctor from like Stanford just talking about a bunch of stuff.
Oh, cool. What else? Anybody else got podcast recommendations? Yeah.
Psychology of your 20s just talks about different situations and like explains how to tackle them while navigating like in your 20s.
Navigating in your 20s?
Yeah.
Is there one for your 40s? What else? Yeah.
Teenager therapy is about these like these are not as high schoolers and they talk about mental health as they go through adolescence.
Wow, super cool. What else? Anybody else got a cool podcast? Yeah.
Stuff you should know.
Stuff you should know, okay. You guys got a bunch of podcast recommendations. I'm going to put one more on your plate, okay? MCAT Basics. Really good podcast that you guys should listen to. It's going to help you sort of get in the habit of understanding a little bit about the MCAT. Subscribe to it. It's free. It's really good, right? And then, as you go through, consider, as you're thinking about when you're eventually going to take the MCAT, there's Kaplan, there's Blueprint, there's Princeton Review, there's a bunch of big box classes. These can be really effective for the right people, right? Just think about how you're going to study and how you're going to do it. For me, I think I remember taking a Kaplan class and I sat in the back and I studied on my own. So it was a waste of money, right? I should have just studied on my own and not wasted that money. So just think about that. It doesn't work for everybody. For those of you guys who are closer to the MCAT, probably a year away or so, we have a whole self-study bundle, which I think is really, really impactful and really, really cheap at the end of the day comparatively. And so I would scan that and save that because I think it's a really, really good way to study. It has an audio course. It has the prep app, which is our sort of mobile component. I think that if you guys can sort of start with this early on, and because it's so much cheaper than other options, it's just a really good way to understand what you need to know for the MCAT. So if you're going through biology and learning about translation, I would listen to the MCAT Go on it because then you would know what the MCAT is really going to test on it. So a good way to sort of start preparing for it early. And the earlier you start preparing for it, I'm not saying like study for it every second of the day right now by any means whatsoever, but I am saying sort of get familiar with what are the things that the MCAT is actually testing. You guys are a couple of years at least away from figuring out what the application timeline is for the most of you, but just so you have a general idea, the process typically takes 18 months plus, right? Which means you apply in May or June of the entire year before you're going to go, right? So if you're going to start school in 2025, you're going to apply in May of 2024, a good 18 months or so beforehand. And then there's going to be the primary application where there's essays. There's going to be secondary application with essays. There's going to be interview prep. There's going to be follow-up letters. It's a whole long shebang. And then eventually, hopefully, you start medical school years later. So a couple of other things that I wanted to touch on, right? How are you going to set yourself apart? Well, at the end of the day, you're going to do all these great experiences. Taekwondo, water polo. Does anybody have another awesome experience they can think of? Well, whatever it might end up being, right? You're going to end up putting this together in an application that's about 10 pages long. So that's all it is. It's 10 pages, right? So you're going to have to figure out how you're going to put all this together into a great personal statement at the end of the day. And one of the most important things I think about in personal statements is the introduction, right? It's got to be a really, really unique introduction because that's what captures the interest of the reader. If you don't have a unique introduction, forget it. So here's a couple of just read these quickly to yourself. These are good, catchy introductions that make me want to continue reading the application rather than put it aside. And trust me, I see a lot of applications where I just read that first paragraph and I'm like, I can't look at this anymore. This goes in the reject pile. I'm looking for any reason to put an application in the reject pile. Now, I say all this, and a lot of this has changed in probably the last 6 months, right? Because now I can go and I can tell ChatGPT to write me a damn good introduction. And I'm not encouraging you to do this, but I don't know where AI is going to take us in the next 4 years in terms of writing, right? Like 4 years from now, this is going to get a whole lot better. This ain't bad to start with, but it's going to get a whole lot better in 4 years. I know it is, right? And so on admissions committees, we're thinking about, hey, how are we going to evaluate this applicant? Is it going to be more interview-based, right? Because the personal statement really has less meaning because if ChatGPT can write it, I don't know. Are we going to do more video-based? Are we going to do more situational-based? MMI interviews, multiple. You guys, anybody know what an MMI interview is? Yeah. That's exactly right. So it's multiple mini interviews, right? So you go into an interview situation and basically there's 6 doors. And on top of every door is a prompt or a scenario. And it says something like, the person you're about to meet is a coworker who you've never met before and you're driving them to the airport. That's the entire scenario. And so you're supposed to walk into that scenario with a trained person who's acting as your coworker and just do whatever you would do in that scenario, right? So it's like, it's a situational interview that puts you in situations where you might not be comfortable, right? We went back to saying, hey, a family medicine versus a pathology doc probably has a very different personality, and that's okay. But what the MMI is trying to do is trying to evaluate, like, hey, how do I put you in a situation that maybe is uncomfortable for you? And maybe that's what we're going to move more towards. About 50% of schools use MMI interviews as opposed to traditional interviews now. And I can see schools moving even more towards that in the future because of things like ChatGPT, because I can't really rely on your personal statement. Show of hands real quick. How many people have used ChatGPT for school assignments so far? Truthfully. right? It's, for those of you guys who haven't, you're going to. It's inevitable, right? At some point, you're going to ask it to do something. And I actually think that's totally fine. It would be like, you know, saying, hey, you're a math major. Have you ever used a calculator? Of course I've used a calculator, right? Like, it's going to happen, but it's going to make the admissions process, I think, very interesting, because up until now, we've relied a lot on that personal statement. I don't know what we're going to do in the future. Anyway, to wrap some of this stuff up, right? I've given you some of the check boxes. I've given you some ideas on like what maybe additional interesting things you can do within medicine are, or within your undergrad career. You know, I wrap it up going back to maybe where I started, right? Medicine is a field like no other. Your patient is going to trust you. They're going to put their lives in your hand. And that is a responsibility that you shouldn't take lightly, right? And so as you're thinking about your Friday evenings and your Saturdays, sitting in a hall like this, making sure your application is good, there's a reason for that, because you want that responsibility at the end of the day, right? And honestly, I really think that the everyday that you get in medicine, that you get with taking care of patients, is like no other, right? It's such a variable experience. It's such a cool experience that, you know, at the end of the day, I think it's actually really, really awesome. Period. I'm going to leave those two up there. Those are the two things that I sort of talked about as I think could be really helpful for a lot of you guys. And I'll end there for now, but I'm going to actually open it up to questions on this talk for now. And then we're going to have plenty of time to talk about other things as well. So how did I scare you guys? Do you guys know all this? Are you guys excited now? Which one? Water polo. Scared, excited?
A little bit of both, I guess.
Yeah. Fair enough. Yeah.
So students are becoming more common now as people taking gap years to do more research. Do you think in the next 4 years will it still be possible to get into medical school without having to take a gap year?
So do you know what the average matriculant age in medical school is? So it's about 25. Most of you guys are going to be 21, 22 when you graduate, right? Which means that the average person has taken 2 to 3 years off. At UMass last year, 90% of the incoming class had taken at least 1 year off. So what does that mean? I think that means that we're all just moving, every school has moved towards, hey, we want more experiences, right? We want students who have more interesting, varied life experiences in our medical school. And so, yeah, I do think that it's going to be harder and harder to get in essentially directly after. For those of you guys who are trying to get in directly after, you got to really maintain stellar grades, stellar MCAT, and do all the extracurricular stuff, which is hard, right? I mean, it is hard to do. There's a lot of cramming that happens in that. You got to take the MCAT during the year. You got to make sure your grades are maintained. So you got to do all this stuff for your application. So it does become somewhat difficult. It's not impossible though, right? So if you are on that pathway, that's okay. You can make it happen. What I would just encourage people is, hey, if there's any hiccups on your pathway, don't worry about it. It's okay to take that extra year. It's okay to take 2 years of a gap year to improve your application. It is, at the end of the day, what the vast majority of people are doing, and it's only going to look good for medical school. Yeah.
So you mentioned that the vast majority, you just said, vast majority of matriculants are taking gap years. What came to my mind though is, what would the best, not the best, but the top tier applicants, what are they doing? Are they also doing gap years, or are they shooting for getting into med school directly after college, or how does their pathway differ?
So it doesn't differ, right? It's the same. So if you're aiming for Harvard versus aiming for, you know, a state school, number one, what I'll tell you is that it doesn't matter where you go, right? Again, if you go to a US-based MD school, even a US-based osteopathic school, you have succeeded, period, end of story. You should not care where you go to medical school. It really makes very little impact at the end of the day in your career. Regardless, let's say you're a top tier applicant who's shooting for the Stanfords and the Harvards of the world, right? You actually probably need to do everything in terms of that 4.0 GPA and 517, 520 in the MCAT, but you need this extra factor too, because there's so many people applying there that the top tier schools are really looking for, like, hey, what has this person done differently, right? What is the it? the it factor is something we talk about at Harvard all the time when we're sitting down in the admissions committee. It's like, what is the it, right? What is the thing that this person has that's different? And honestly, every admissions committee is thinking the same thing, right? I mean, you guys went through this process just last year for college applications. It is ridiculously competitive, right? It sucks. It's so competitive. And that's the reality for med school as well. So I would go back to your question. It doesn't really matter what type of school you're aiming for, or even necessarily who you are as an applicant, because there are a lot of applicants who might be really great, 4.0, 520, and say, hey, you know, I spent so much time studying for the MCAT or doing well in classes, I didn't have time to develop my extracurricular side, and now I need an extra year to do that. And so you can take that extra time. Yeah.
How would you recommend managing personal finances in your 20s with all this stuff that you're going to be taking on? You don't have like a safety net.
Yeah, so how would you manage personal finances? It's hard, right? It's hard in this situation where school's expensive, right? You guys have all made probably a very prudent financial decision in going to your state school, which honestly probably already saves you a ton of money compared to private school, and you guys are going to one of the best institutions in the entire country. So that's actually a really good start right there. B, you know, you're thinking about saving on a daily basis. You know, I'm going to channel my inner Shark Tank here. Have you guys watched Shark Tank? You know Mr. Wonderful, right? He comes up on my YouTube reel all the time, right? And he's always coming up on my YouTube, and he's always like, I know who's going to be rich and who's going to be poor. The person who's going to be poor is the person who spends $6 at Starbucks every day. And the person who's going to be rich is the person who puts that away and instead makes their own coffee, right? So, I mean, listen, if you like Starbucks, like go get your Starbucks. I'm not going to tell you not to, but there's all kinds of these little things that hopefully you could do. The other thing that you should think about is there are opportunities for scholarships. There are opportunities for tuition reimbursement. There are opportunities for repayment plans based on your specialty and where you eventually practice, right? So they're actually community-based programs where you can say, hey, I want to be a family medicine doc, and I'm going to practice in a government hospital or government setting for the next 5 years, and so all my student debt is wiped out. Or my repayment schedule is much better than it would be otherwise. So there's opportunities later on also to think through that and find those, you know, I would say just look at those and find those and think about how to maximize those. It is an expensive process, unfortunately. That's some of the reality. But at the end, you know, I put up that slide of the UPS driver versus the physician. One thing I'll say is that at the end of the day, if you are a physician in the United States, you're always going to have a very solid paycheck, right? It's not going to be as much as the private equity guys, it's not going to be as much as the lawyers, but you're going to be comfortable, right? You shouldn't really worry about it years from now. You're going to have a very comfortable lifestyle, and you'll be okay. Yeah?
What are some practices and habits that you adopted that helped you get through med school?
Let's see. So for myself personally, one of the things that I like to do is stay really busy. And so for me, it was actually about like finding the time to like compartmentalize, let's say, studying, right? So I stayed really busy by not studying all the time, but actually by playing ultimate frisbee all the time, or by in college being on the dance team or whatever else. Like, and that took up so much time of my life. And you would say, well, shouldn't you have been studying? Well, actually, I found for me personally, I found the opposite true, which is if I spent all this time doing other things that I like to do, taekwondo, water polo, right? All these things that are interesting, that I could then take the hour and have a much more efficient study time than if I had 6 hours of study time and was like craving doing the other thing. Now that was me personally. Everybody's going to have different things that can make different people tick. But what I would say is that you guys have all been very successful up until this point. That's why you're here. You're at an amazing school, right? Think about what has worked for you, right? And don't go away from that in college, right? Again, if it is that, hey, in high school I was playing sports until 7 p.m. every night and then I was doing homework, like do that, because it'll help you do better in college as well. Yeah.
What is a way that we can prevent student burnout?
I think what I just said there was is impactful to that too, right? It's easy to get burned out, right? How many classes are you taking this semester? 5, right? So 5 classes, you probably have a lot of problem sets, you probably have a lot of homework, easy to get burned out, right? So I think a couple of things to think about. One, keep your hobbies, right? Do those things that are interesting to you, because otherwise it's not worth it, right? It's not worth sitting in the library every single day and doing nothing else. You won't be mentally there. So take the time to do other things. I think the other thing is, there was a question about gap years before, right? Like, don't think you have to, like, life doesn't start when you become an attending in medicine. It just doesn't, right? There's a lot of life before that. And so don't think about, a lot of people will say, hey, you got to rush to get to the point where you're earning money and attending. I actually think very differently compared to that. I think the best years of your life are going to be way before then. So take that time, decompress, take the time to travel, take the time to enjoy with your friends, take time to get married, whatever else it is that you want to do in that time. And don't just think that, hey, life is going to start when I'm attending. Because if you just think that, then you're going to burn yourself out, right? Because then it's like, I'm on the clock for the next 10 years before I actually get to practice. And that's where the burnout really comes in. Yeah.
So I guess in terms of like picking a medical school, like I assume you were like a really competitive applicant. Like, what did you focus on, like in terms of picking where you belong? Did you focus on the money aspect, or were you looking at prestige? Like,
It's a great question. So I was choosing between UPenn and UChicago. And Philly smelt like urine to me. Every time I went to Philly, I was like, it really smells here. And Chicago was like this clean, beautiful city. And so I went to Chicago. like that was what it was for me at the end of the day, right? I go back to, listen, every single medical school is going to be a great opportunity for you. I hope all of you have an opportunity to choose between multiple medical schools at the end of the day. That's a great, great feeling to have, because you get to choose, you get to compare financial aid packages, you get to think about like, hey, what are the research opportunities here? Like, what's the class size? UChicago was a nice small class size. It's also something I like. We had about 90 kids in our class. So that was, it was a small group. It was in a beautiful city. My significant other at the time was there. Like, so there's a whole bunch of things that led me towards that made me eventually happy there, except for the pizza. The pizza was really thick, which I didn't like because I was a New Yorker and I like thin crust pizza. So there are always going to be things that you're maybe unhappy about at a school. But at the end of the day, I think, if you get to choose medical schools, you're in an awesome, awesome situation. And every medical school is going to get you to where you need to be. I really, 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 truly believe that. Yeah.
I think Baylor College of Medicine compares to Chicago.
Say again?
How do you think Baylor College of Medicine in Houston compares to Pritzker in Chicago? Because I know that Baylor is, well, ignoring the fact that it's cheaper, it has direct access to the largest medical center in the world, right? And I'm not knocking Chicago by any means, because I like it quite a bit. But I'm just curious to see, you keep saying, what med school you go to doesn't matter, it's a marginal difference as long as you go to in the United States. But I'm curious to see your thoughts on Baylor specifically.
What I would say is, if you have that decision to make at that time, let's talk. Because it's a great decision to have, and there's pros and cons, right? They might say, hey, Baylor's here, it has a great medical center. There's all kinds of different things that go in. To compare two schools up against each other just out of the blue is probably not really all that relevant. But hopefully you have that decision and you can make that choice. Yeah.
What made you decide to become a physician instead of, let's say, like a nurse practitioner or a CRNA?
So all potentially great careers, right? Everything, right? Physical therapist, Dr. Vora's physical therapist, right? CRNA, NP, PA, these are all great things that you can go into, and all the things I just said apply, right? You get to take care of patients on an everyday level. You get to really be, you get to really be there for them. For me, to be honest, I didn't really think about going towards those other pathways, but it might be an exceptional pathway for a lot of people, right? Particularly things like NP and PA right now. We need a lot of them. They're great physician extenders. In some states, NPs are practicing on their own without physician oversight. there's some controversy about that, and there's two sides of the fence to it. I'll be honest, right? So there are a lot of physicians who would say, well, we have hundreds of thousand hours of training versus an NP who might have 100 hours of training. It's not the same. So there is sort of friction in that realm. Regardless, patients need access to care, and being an NP or a PA might be a great way to do it. I work with a lot of NPs and PAs who know a whole lot more than I do about their specialty and what they do. And so it's a potentially great option if you want to go that way. I think the things to keep in mind or things to think about are, at the end of the day, do I want to be the ultimate responsible person? Because in most situations, the physician is ultimately responsible. Even in cases where, let's say, there are CRNAs, there is a physician who's signing off on that and is the ultimate responsible party to that. And so there's a slightly higher level of responsibility. There's a much longer training pathway for physicians. So these are, I think, some of the things to consider. Like, who do you want to be? What type of person do you want to be? But then again, like if you go the PA route, you got to take care of patients. You probably done a lot quicker than MD. Requirements probably are not as stringent. So it could be a potentially great route where you really get to take care of patients as well. So I don't discount them whatsoever. I think it's potentially a great career pathway. Yeah.
If your volunteer experience is affiliated with some kind of like religious affiliation, would that impact my application in like a negative way?
No, I mean you can certainly be in a volunteer experience which is religiously affiliated. Now, I would caution against maybe like bringing out the religious component as the most crucial of that, right? But there are obviously a billion faith-based groups that are doing amazing work, taking care of patients, helping others, and like emphasize that portion because that's going to be universal regardless of what your faith is.
So regarding like how many medical schools you should apply to, I've heard like varying aspects of like how little or how many medical schools you should apply to. What is like your
So
recommendation?
it really depends on the particular applicant, what their situation is, right? Start with that. But in general, we're applying to anywhere between 15 to 40 schools. It's a wide range, but because it's so competitive, the more schools, the more chances you have. But it really depends on your situation, right? So if you're a spectacular applicant who has a state school you're really happy with, maybe you only have to apply to 15 because there's no such thing as a safety school for medical schools, but you have like a really good target school, right? Whereas if you're sort of more of a middling applicant, want to go anywhere in the country, maybe 30, 35 schools is not unreasonable. Most of our applicants who we work with on a yearly basis, so what we do is we take these applicants like yourselves, we coach them through 4 years of undergrad plus whatever else they need to do, and then eventually on the application process, and we're working with them and figuring out where you're going to apply, what's your personal statement, what extracurriculars are you going to do. And for most of those applicants, we're probably applying to 25 to 40 schools.
You studied engineering in your undergraduate, so first, what was your thought process, and like why did you choose to study engineering versus biology, industry? And then second, like when you look back on it, how do you feel like it has impacted you become the doctor you are today?
Yeah, so great question. So I studied engineering because I wanted to be a rocket scientist. And I was like, I want to be an aerospace engineer. This would be really cool. And then as I was going through engineering, I learned or kind of figured that, well, it turns out like aerospace engineers don't actually design the airplane or the rocket. They design like one little nut on the rocket or like one little bolt. And I was like, it's kind of boring. So I sort of shifted my perspective towards medicine, right? And it was really, for me, one of the most impactful things was I wanted to come home every day and really feel like I made an actual impact on somebody's life. I had a cousin who was a couple of years ahead of me, and she went into management consulting and marketing. And she was super excited about her everyday job, right? She would come home and she would tell me, hey, I'm doing these great things. It's really fun. But her job at the end of the day was to ship more men's deodorant than her competitor. And I thought about that and I was like, I don't really want to ship more men's deodorant. Like, it doesn't really matter to me. I wanted to just really feel like, hey, I worked with a couple of patients, I made an impact today, I changed somebody's life, or at least I impacted it. And that's where medicine sort of came in. And then, being an engineer or having that analytical mindset is actually super great in medicine because not a lot of people do. It's changing. A lot more engineers today are in medicine than they were probably 10, 15, 20 years ago. But having that sort of mindset of being able to do numbers and think through a problem like an engineer does, I actually think was super helpful in my career. So, it's like, is there a stigma of going to a state school versus a private school? Sure, some people might say, oh, you went to state school, but you could respond, I went to the best damn state school in the country, like, go to hell, right? So the reality is that, listen, there is probably, in different parts of the country, DO versus MD are probably reacted a little bit differently. The general public might not understand the osteopathic pathway as well. But at the end of the day, you get to practice medicine in the United States just like an MD would with no restrictions whatsoever, period, end of story, right? Now, there are going to be definite specialties which are harder to get into from the DO pathway than they are the MD pathway. A lot of the subspecialties like dermatology have very, very few, if any, osteopathic physicians. They're almost all come from MD schools. So you're going to have some limitations in sort of the specialty you get to choose and pathway you get to be. And you might have some stigma maybe from a patient perspective or from a referring physician perspective. But most who know at the end of the day understand, listen, whether or not I work with osteopathic physicians every day, whether you're an osteopath or an allopath, you're a physician who takes care of patients, you're licensed exactly the same, you have all the same credentials, period, end of story. And so I would say, if DO is a pathway that you end up in, you're going to be great.
Going off of that, do you have any opinions on people going to DO school that don't want to go to primary care?
Yeah, so I would say think about what specialty you want to go into, right? So if you were clear that I want to be a dermatologist, right? Which I think somebody in the audience was. How many dermatologists do we have in here? Pimple Popper MD? Just kidding, right? If you're clear you want to be a dermatologist, right? Then DO school is probably not the right pathway for you, right? And you might want to think about taking another year, retaking your MCAT or whatever else it is to sort of boost your application to try to get into an MD school. Now, if you want to go to, let's say you want to be a cardiologist, you could totally do that so there are some specialties where you could totally do it, right? Because cardiology goes internal medicine and then cardiology. So a lot of osteopathic physicians will match into internal medicine without a problem. If you want to be an orthopedic surgeon, I might tell you, well, you're probably better off going the MD pathway than the DO pathway. So a little bit depends on the specialty, but it's not always just primary care versus not. You could be a specialist from a DO for sure, but you want to think about it, right? So if you have a definite specialty in mind, you want to say, okay, is this the right pathway for me? And it might be, and you can do a lot of things, but there may be a situation where you say, okay, we'd rather do something else. So these are great, guys. It is almost 12, and Dr. Vora is going to talk, and I think there's lunch too, right, Aaron? So I don't want to keep you guys too hungry. Now, I'm going to be here all day, and so I want to answer all your questions, but I also definitely want to give our other speakers some time. I want to give everybody time for lunch as well. I'm really excited to, again, speak to you guys, be a part of this, excited to do some suturing, excited to do some stop the bleed, and continue the conversation with you guys throughout this session and the next.